to start, it's so transmissible. It's going to go person to person on U.S. soil, right? These cases are not necessarily, isn't the case that they have traveled to Europe and now they are coming here. I think that one of them maybe had travel history, but more likely that the variants are here and they're now spreading person to person on U.S. soil. So we call it the UK variant, but again, that transmission is happening locally. And we just want to emphasize that that's one of the reasons that you need to continue wearing a mask, washing your hands, staying at home if you're sick, disinfecting surfaces, because we're still learning about these variants. We know that they're more highly infectious, still gathering information to know if they cause more severe disease, still gathering information on the efficacy of the current and future vaccines on the variants. And then also, we never know when a new variant might pop up. So again, wear your mask, keep your distance, wash your hands. All right. Then the big news of the day, I suppose, is earlier today, it looks like just a couple of hours ago, the Alabama Department of Public Health announced this. The governor and ADPH announced that starting February 8th, ADPH is going to extend eligibility for COVID-19 vaccinations to include people 65 or older and other frontline workers. So again, this is to begin statewide on February the 8th. It includes people over 65 and frontline workers such as first responders, correctional officers, food and agricultural workers, U.S. Postal Service, manufacturing workers, grocery store, public transit workers, people who are in the education sector, so teachers, support staff, colleges, universities, that sort of thing, child care workers, and judiciary workers like judges, district attorneys, that sort of thing. So those groups, in no particular hierarchy, will be eligible for vaccine statewide starting February 8th, the groups, and also 65 and older. It's really important to recognize that with this announcement did not come the announcement that we have enough vaccine for all of these groups, right? Where the state has decided to extend eligibility, we did not, get a huge amount of vaccine and then decided to do this. We're still getting, a trickling of the vaccine coming in, but we want to make sure that when we do have vaccine, that we can get it out to as many people as possible. So again, the Mobile County Health Department still does not know if or how much vaccine we will get next week, much less the week of the 8th or the week of the 15th. So please continue to be patient with us and be patient with the other COVID vaccine providers in the county, because this is opening up eligibility to over 100,000 people in Mobile County. And it's going to place incredible pressure on those locations that are trying to provide COVID vaccine in the fastest, best, most efficient way as they can. So again, just appreciate your continued patience as we still are experiencing critically low volume of supply of COVID vaccine at this point. So if there have been any questions on Facebook, we'll take those. Mark is saying no. Hold on.
This is mostly about
the expansion.
The expansion in next week's, the 3 locations.
Okay, the 3 locations next week. So it's.
That includes.
Yeah. So we'll make some determination about that next week. Right now, all of our press about those clinics next week is based on the old eligibility, or not the old, what we were doing before the ADPH announced this. And so we'll have to, look at our vaccine supply and talk internally about, if or we're able to open up the clinics next week using the additional eligibility or not. So we'll get that information together as quickly as possible and we'll let you all know. Okay, so look for something official from us shortly if we're going to make any changes to the vaccine clinics that we have next week. Does that address the question?
And
Okay.
will there be a verification plan for the next phase of the so-called frontline workers? The other,
Yeah, so this is pretty specific, and there's in the ADPH news release, there is a link to more specificity. So right now, like I said, the news alert that just came out a couple hours ago, first responders, correctional officers, food and agricultural workers, U.S. Postal Service workers, manufacturing, grocery stores, public transit, education, and judiciary and childcare. So first responders have been open all this time. So I think you know who you are. Bring an ID, bring your badge, bring some sort of credential when the clinics open up. And we recognize that there are, people are trying to get as much vaccine out as they can. We had heard about an event today that opened to some additional groups, eligibility groups. The important thing is that when you have people in front of you and you have vaccine that has to be put in arms, because again, this is a very delicate vaccine. So if we take vaccine out to give it and there's not, a complete line, right, we've got to find people to give shots to. So some of that reaching outside of groups and the person that's, younger than 75 getting in, or a teacher getting in, or some of those things happen. You're right, it does. And it will continue to happen because we're not going to be out there policing these types of opportunities, because sometimes there's a very logical reason behind it, that you had some extra vaccine at the end of the day and you needed to get it in arms rather than throwing it away. So again, more on Monday about the expansion announced today by the Alabama Department of Public Health that goes into effect on February 8th. We'll talk more about that on Monday. Give us some time to digest these things.
What about underlying health issues?
So underlying medical conditions for people less than 65 was not addressed in today's announcement from ADPH. But again, we have some calls today with the state at 3 and 4 o'clock, and we'll be trying to, clarify some of these subtleties so that we can let you guys know, hopefully, what we know as quickly as we can. It's things are changing by the hour, so appreciate your patience as we try to sort of, adapt to the ever changing landscape of COVID-19. All right, I'm getting the that's it sign from Mark. So with that, I'll just end our comments for our Facebook Live update for today. Hope you all have a lovely weekend, and we will be back with you on Monday at 2:30 to provide more updates on vaccine locations and eligibility starting next week and beyond. Have a great weekend.